Hey everyone, welcome back to the channel. If you're watching this, chances are you're getting ready for the Neurology RITE exam, and the clock is ticking. No worries, I got you covered. In this video, I'll walk you through a solid last-minute strategy, the high-yield topics you must know, and some test-taking tips to help you get the best possible score. So let's jump right in. First things first, what is the RITE exam? RITE stands for the Residency in Service Training Examination, and it's an annual test developed by the American Academy of Neurology, designed to assess where you stand in your neurology knowledge. It's a long exam, 400 multiple-choice questions, and it covers everything: stroke, epilepsy, movement disorders, neuroanatomy, neuro-oncology, and even some basic sciences. Expect to be tested for about 8 to 9 hours, usually split into multiple sections. You can pause between blocks. As for cost, most residency programs pay for it, but if you're taking it independently, fees can range from $100 to $160. So, check with your program to confirm. All right, now let's talk strategy. What should you focus on in the final days before the exam? You don't have time to review everything, so prioritize these areas. 1. Stroke and vascular neurology. Know your major stroke syndromes: MCA, ACA, PCA. Be clear on TPA inclusion and exclusion criteria. Learn the key time windows for thrombectomy. 2. Epilepsy. First-line drugs for focal versus generalized seizures. Status epilepticus management. What do you give first, second, and third? Key EEG patterns like generalized periodic discharges or PLEDs. 3. Movement disorders. Parkinson's versus essential tremor. What are the differentiating factors? Huntington's disease. What's the genetic mutation? 4. Neuromuscular disorders. Myasthenia gravis versus Lambert-Eaton. How do you differentiate? ALS. What's the classical presentation? 5. Multiple sclerosis. McDonald criteria. What's needed for diagnosis? Disease-modifying therapies. When do you use what? 6. Headaches and pain syndromes. Cluster headaches versus migraines. Diagnostic criteria and treatment differences. 7. Neuroanatomy. Brainstem lesions. Know your medial versus lateral syndromes. Localizing spinal cord lesions. If any of these topics feel weak for you, focus there. Your goal in the last few days isn't to learn new information. It's to reinforce what you already know and maximize recall speed. Now let's talk about study methods. What works best when time is short? Practice questions. Do at least 30 to 50 questions per session. Time yourself. Read the explanations, even for the ones you got right. Review weak areas. Go through your incorrect answers in question banks and make quick notes. Prioritize your biggest knowledge gaps. Use flashcards or mind maps. Draw out pathways, summarize key criteria. The more visual, the better. Teach someone or speak out loud. If you can explain a concept, you know it. Try teaching a friend or just talking through difficult topics out loud. All right, so you're walking into the exam. Here's how to make sure you perform at your best. 1. Get enough sleep. No all-nighters. Your brain needs rest to retain information. 2. Eat smart. Avoid heavy carbs before the test. Go for protein, healthy fats, and hydration. 3. Manage your time. Don't get stuck on one question. If it's tough, mark it guess and move on. You can come back later. 4. Use process of elimination. Even if you're unsure, you can usually eliminate 1 or 2 answer choices. That increases your odds of guessing correctly. 5. Stay calm and confident. You've trained for this. Trust yourself, breathe, and focus on what you know. All right, quick recap before we wrap up. Focus on high-yield topics. Stroke, epilepsy, movement disorders, and neuroanatomy are key. Do practice questions and review your mistakes. Use rapid recall, flashcards, teaching, and quick summaries. Manage your time during the exam, and don't stress over one question. Remember, the RITE is not just about the score. It's about learning and becoming a better neurologist. No matter how this exam goes, use it as a stepping stone for the boards and beyond. If you found this helpful, don't forget to like, subscribe, and drop a comment below. Best of luck on your exam, and I'll see you in the next one.